We are going to be talking all about fertility, pregnancy, and a healthy postpartum period. For those that are joining us for the first time, my name is Jariel. I am a certified doula, and my job is to inform, inspire, and empower parents and expecting parents around their maternity journey. And I am so happy that today we get to talk all about fertility, we get to talk about pregnancy, we get to talk about the fourth trimester or the postpartum period, and we are going to do that now. So thank you guys so much for joining us. I really, really appreciate it. And I am going to add our special guest, and we'll go ahead and get started.
Hello.
Hey, how are you?
Good. How are you?
There you are. I'm good. I was just getting everybody ready and just saying hello. I would love it for you to go ahead and introduce yourself and what you do.
Yeah, sure. Thanks so much for having me. My name is Rishma Walji. I'm a naturopathic doctor, acupuncturist, and also have a PhD. So I spend a lot of time learning and researching and things like that. And I've been in clinical practice for almost 18 years, working mostly in women's health, actually, fertility, pregnancy, postpartum. Those are the areas that I love.
Yeah, and we absolutely love talking about pregnancy, birth, and this whole thing. So if we go too far, just comment below and type a question so that way we get back on track.
Okay. Yeah, I'm actually very excited to talk to you. I love your mission. I love what you're doing and educating women. It's so great.
Yeah, same. And I absolutely love you too. Like, we have really, really good energy together. And I feel like our purposes and our missions align so well, which is always great. So I do want to ask you, though, before we get too far into it, to talk about like naturopathic medicine and like what exactly is the study of naturopathic medicine for people who may not know, because I didn't know before last year.
Yeah, for sure. So essentially, we're healthcare providers in the allied field. So you would think of maybe like a massage therapist or a chiropractor or, someone, an optometrist, someone who is in healthcare. But we approach it from a different perspective than I would say conventional care. We look at lifestyle, we look at nutrition, we look at vitamins, we look at herbs, sometimes herbal medicine. So we're looking at health from a preventative perspective, but also from a more natural perspective. And then each person would have different, areas of focus, like myself, women's health, but it might be someone else might be focused on pain or, depending on where they were trained or what their interests are. So everyone kind of has their own sort of area of interest. But essentially, we look at health from a more natural perspective, and I would say more of a preventative perspective. So looking at preventing some, future issues, things like that.
And how does that translate into your work with fertility?
Yeah, so for me, it actually started with women's health. I was obviously being a woman. I've got 2 daughters. Like, it's very interesting to me just generally. But I started more in general practice, and then I had a lot of women coming up to me having hormonal problems. So I started going through that. And then I actually had one woman come in. It's a really sad story, actually. She had very bad issues with her periods, and she ended up having endometriosis. But at the time, she didn't know. And she'd gone through her whole life. She was in her 40s by the time she saw me. And no one had told her that it was not normal to have very intense, very heavy, very painful periods. And she just thought, well, it's just I'm a woman and I just have to go through this. And we ended up going through this very emotional conversation in my office. And I was like, this is not normal what you're going through. And she's like, I wish someone told me. Why did no one tell me that there was something I could do or that this wasn't normal? I just thought that, something was wrong with me, and it affected her ability to have kids. It affected her marriage because she was having painful intercourse. All these things were happening to her. And it just kind of triggered something in me that, I have this information inside me, this knowledge, this training, this expertise, whatever you want to call it. And women need this information. And how could she have gone through 20, 30 years of her life not knowing the information she needed to know? And I think it's just, it's hard to get that information. We learn at school, don't get pregnant. We learn, what our period is. And that's basically all. No one ever tells us anything after that, And so that's where I kind of felt drawn to this work.
Yeah. Hey, Taylor. Hey, everybody that's joining us now. Taylor is saying, I feel like it is so common for women health issues. Yeah. And they're not really discussed. And when you do try to discuss it, you're normally told like, wait, or it's normal or it's natural. And no one ever gives you recommendations or other options for things that you can do. And that's why this conversation is so important. And we're so excited to have you. So, we talked a little bit about naturopathic medicine. We talked a little bit about how that translates to fertility and what you do. So tell us a little bit about like what are some reasons that people go through fertility challenges? Like what do you see as some of the most common ones?
Yeah, that's a really good question. So sometimes someone has a more explicit issue, like they know something's going on in their body. So, like in this woman's case, she had a condition that is now a little bit more well known, but still needs more awareness, called endometriosis. Some people will have something else like PCOS, or they might have irregular cycles, and they know, like, look, something's going to be it's going to be harder for me to get pregnant because I don't get a regular cycle. So sometimes it's really obvious. And sometimes it's less obvious. Sometimes they maybe don't ovulate efficiently, or they've been on the pill for so long that their body needs some time to kind of, get back into a regular cycle. Or sometimes it's this unexplained sort of diagnosis where they don't know why you're not getting pregnant. But in my world, typically I see that there's something going on where the person's metabolism is off, or they don't have the right nutrients, or they have other things that affect their circulation. So there's a lot of different reasons why. It's not necessarily a one-to-one relationship, though. Like, oh, if you have anemia, you're not going to get pregnant, but it might impact your circulation, which could then impact your ability to either get pregnant or stay pregnant. And then the other thing that I notice a lot right now, I'm not sure if you notice this as well, but women, of course, these days are having kids a lot older than they did when, our grandparents were having kids, let's say, right? Mm-hmm. And so that's another issue too, that sometimes we don't realize that our bodies are changing over time. And so that can impact our ability to get pregnant as well. Not that there's nothing you can do. You can definitely do some things about it, but it changes your risk.
Okay, so then since we're talking about some of the struggles and challenges that people face, like what are some tips that you can give for people that are facing fertility challenges right now?
Yeah, I love this question because there are things you can do. And I think, of course, there are some things that are out of our control. And I don't want anyone to feel like it's their fault or anything like that. There's definitely so many things that are out of our control. But this is the thing that I think a lot of women don't realize. There are things that you can do to improve your chances. So the very first thing is you have to understand your body. And as I said, we get taught this stuff when we're in high school. We don't really understand what's going on in our bodies. We just know that we get a period once a month maybe, and it's inconvenient and, it's a problem or whatever. Like, we don't think about it in a way where it's like actually telling you about your body. It's actually a sign of your body, whether it's working well, if there's good health, like it kind of teaches you. So the first step to really taking the proactive approach is to understand your body. Is your period really heavy? Is your period too light? Is it very painful? Is your ovulation on time? And most of the times we don't pay attention to ovulation. We just pay attention to the actual bleeding phase. But if you understand when the ovulation is happening, that can help you understand if it's happening when it should happen, or if there might be a problem. Because as we get older, for example, our ovulation will change, or our hormones will change, or maybe we had heavy periods before, now we have light periods. That might tell you something about the uterus and the uterine lining, which is necessary for the baby to implant. So the first step is, without getting too complicated, I could talk about this for hours, but I think the first step is really to understand your body, right? Understand how your body works. And so some of what I do is I give women handouts on, like, this is what you should be tracking. If you're using an app, don't just check when you get your period. Check, how heavy are you bleeding? When is your ovulation? When do you feel tired? When is your bowel? Like, maybe you get constipated. Like, these are things that we need to keep track of, I think, in more detail than we're currently keeping track of. So if you're not thinking of having a baby, but you're maybe thinking of having a baby later, maybe not now, still understanding your body, because you only get that information once a month, right? So keeping track now is really, really critical. So that's the first step, I would say, in terms of proactive steps, is really understand. And then if you find out you have an issue, let's say you realize that your period's a little off and you don't get it every 28 days. It doesn't have to be 28, but let's say you get it every 43 days, or you get it sometimes after 50 days and sometimes after 20 days, you know that there's something might be off. That's when we usually move to the next step, which is, I would call it repair, like fix things that are wrong. So if there's something going on, maybe that can indicate that there's something happening in your metabolism or in your hormones. Like that's when I would say there's a lot to do with natural medicine, where we can really help to balance the hormones so people can have more regularity in their cycles, which then means they're ovulating, which then means they're more likely to get pregnant. And then the next step after that, I would say there's a couple more steps, and then I'll get you to get me into more detail if you have more questions. The next step would be to remove problems. So this is the phase that some people know. They're like, oh yeah, I want to get pregnant now. I should stop drinking. Which is, we kind of think, okay, we're going to remove things that we think might be bad for pregnancy, right? So we're like, okay, we should probably stop drinking alcohol. Great. Absolutely a good move. But there's so many other things we're exposed to that we might not realize, chemicals or toxins or things like that, that are actually all over our environment and even in our home. So there's other things you can do to sort of remove the barriers, I call them. And then the last step is to optimize. So really make sure your body's working, not just well, but amazingly well. So that's when we think about vitamins and nutrients and prenatals and things like that. Most people just jump to the prenatals, but that's missing a bunch of steps. You know what I mean? And then the last thing that is super important, that is a little harder to talk about maybe, is also the partner's role. So I feel like a lot of guys get nervous about talking about this. They get shy, or maybe it's harder for them to talk about. But sperm is 50% of the issue, right? So a lot of fertility problems, even miscarriages, sometimes get linked to poor sperm. So having the guy really work through his health is really, really critical too.
Okay, so let's back up. First, you said track. So do you suggest apps that people should track? And then also, I don't know how to say this properly, so forgive me, but like some people don't know like what their body will do that will signal ovulation or things.
Absolutely.
Right. So like, what do people even know? Like, what are they tracking?
Yeah, you actually bring up a really good point, because I would say that some of the research says up to 70% of women don't know when they're ovulating. Even when they think they know, they might not actually know. So that's a really good question. So the first thing is, I absolutely recommend apps, because I find that they are helpful. We forget, right? Like if I ask you how your last period was, you might remember. But if I ask you how your period was 3 months ago, you're not going to remember the details.
Right.
So I think the apps are helpful to keep track, to help you understand the dates, to understand the details, because also our hormones fluctuate. So if you're like me, like I might feel emotional one day of the month, and then the next day I'm like, everything's great. And then one day I'm like, everything's terrible. So you feel differently. You're going to remember differently. So if you keep track on an app, absolutely, that's helpful. I use it for memory, and I use it for patterns. So then I can look back on the app and be like, last month it was day 27. The month before that was day 25. The month before that was day 29. It helps me figure out patterns. The problem with apps, I think, and nowadays they're actually getting a lot better, is you have to also keep track of all the other details. So I actually have it's a free handout. If anyone wants, you just go to my Instagram page and you can get it on my bio. But it's a free handout. Basically, it tells you, like, I also want you to keep track of not just when you get your period, but all these other symptoms and all these other things and details, because that will tell me if your hormones are imbalanced. Now, the average woman might not be able to know why that's important, but if she has that data, then I can help her figure out why that is different. Why are you getting very light periods? Why are you getting very heavy periods? That kind of thing. And then when it comes to ovulation, I spend a lot of time talking about ovulation with my patients. And it's because even if they've been trying for years, if you're not catching your ovulation window, you're not going to get pregnant. And you have 12 shots in a year, right? Like 12 chances. It's not that many. Like a year sounds like a long time. So there are some ways to test to see if you're ovulating, but I have to say again, understand your body is the biggest one. You will notice changes if you really pay attention. And there are some changes that are more obvious than others. So that's like something that there's lots of handouts and lots of explanations, because each woman has maybe slightly different symptoms, but there are things that tell you, your libido might be not as reliable because you might be tired, you might be stressed, or you might have had a fight with your partner, but then maybe you might get some discharge, or you might get, some other types of changes. And those are things to keep track of.
Okay, got it. So we can use apps. You also have something in your bio that we can use to help us track different things and know what's important to track. And there's information in the patterns.
Yes.
Okay. Okay, awesome. And then you mentioned like cutting out chemicals. So I'm assuming you mean things in like our lotions, our makeup, and things that we use to like clean around our house, right?
Yes, it gets a little bit depressing when I've been doing this research for a while, and I have to say it gets a little bit depressing when you realize how many chemicals and toxins are in the world. So what I say is don't get overwhelmed because, again, just to give you a sense, there's research to show that some babies will have up to 200 toxins in their cord blood. Like, that's a lot of different toxins in a baby's cord blood, right? Like, that's a lot. And so, I mean, research varies. There could be more, could be less, but there's so many things that we're exposed to that we don't realize can get passed on to our babies, right? So it gets overwhelming. Usually what I say is, let's just look at each part of your life. And if you have time and you're not like already, say on the path of trying to get pregnant yesterday, because that's when most people reach me. But let's say you are planning, right? You're thinking about in a couple of years. Go through each part of your life and just see where you can minimize toxins. So makeup is a really good example. I have lots of resources on my website. Plastics are a good example, cleaning, chemicals. But if you try to change everything at once, it gets really overwhelming and then people get stressed, which is definitely not what I want. So I would say every time you come up with a new product, just find a cleaner product. And again, like I said, this is something that I spend a lot of time on with my patients because, again, it's like each product might be good. Each product might have, some kind of ingredients that are reacting with you. So there could be some nuances, but generally what I say is just try to find one cleaner product each time you run out so that you don't get overwhelmed.
Okay, so we talked a little bit about fertility. We talked a little bit about the things that we can look for as far as patterns within our cycles. We talked about what we can do to remove chemicals and become a healthier oven, as somebody said recently to me, which goes outside of just cutting out alcohol. And then we also talked about how we can optimize the information that we're receiving. So now that we kind of talked about fertility, I just want to say hey to everybody. Thank you guys so much for joining us. Today we are talking all about fertility. We're talking about pregnancy. We're talking about being healthy throughout the journey. And so we're so excited to have you. Thank you so much for joining us. I see First Lady Lane. She's saying great information. I wanted to ask you about like pregnancy. So what are your tips for like a healthy pregnancy? So we did everything that you said before. So now we're pregnant. And then what can we do to be our best selves during this period?
Yeah, that's a good question. I would say that most of the healthy changes happen before you get pregnant. So a lot of women will call me and be like, shoot, I'm pregnant. I was so busy trying to get pregnant. I didn't realize, what do I do now? So the good news is when you get pregnant in a healthy way, or when you have kind of worked through your body to make it a little healthier before the pregnancy, a lot of the miscarriage risk goes down. So that's a really good thing. Like, your body is already ready. The egg quality is good. The sperm's good. In theory, if you were able to spend, even if it's a few months or, 6 months getting your body ready, in theory, your pregnancy will also be healthier. That's especially that first trimester when it's a little bit more risky, I guess. That's the first trimester where you know that, okay, my body's already in good shape and now I have a better chance of having a healthy pregnancy. Moving forward from that, a lot of those tools like reducing toxins and things like that are still relevant, but also your hormones are changing during pregnancy. So that's when we have to pay attention to your hormonal changes, your emotional state, your sleep, all of those things from a health perspective really make a difference. And so they really take a toll on the woman as well. So that's where I would say we really want to take care of the mom and just say, as much as we can do to support her. I also feel, and maybe this is cultural, but like things that I know from our culture is, you're supposed to have other women around you. You're supposed to have people supporting you. And these days I find, like, I remember when I was pregnant, I'm in Canada, and I find like I was working and I was busy and I was, we do all these things and it's hard to take care of ourselves. So what I usually say is, we want to look at nutrition. We want to look at vitamins. Obviously, all of those things are important, but we also want to make sure we're getting sleep and we're taking care of ourselves and we're getting the rest that we need. So that I would say is really critical during pregnancy, and taking care of yourself in terms of your body's, optimizing your body, your metabolism, your vitamins, all of that before the pregnancy, then you'll have a much better chance of having a healthy pregnancy throughout.
Okay, awesome. So we have a healthy pregnancy, and now we're like going into the 4th trimester, or our early postpartum period, which is like the first 3 months or so after your baby is born. Do you have things that we can do to kind of prepare for life as a brand new mom?
Yeah, for sure. This is it's such an important question because I find a lot of people are really overwhelmed after that baby comes, right? Like they're
Yeah.
thinking about pregnancy and labor and delivery, which I know you do a ton of work on labor and delivery, which I love. I used to be a doula. I love it.
Yeah.
And I also will help people with acupressure points and things like that to help them get through the labor. But then
Right.
afterwards, it's like, shoot, we have this baby. What do we do now? Because it's like, now that you get there. And so a lot of people get really overwhelmed. And by the time they ask for help, because they're so overwhelmed or sleep deprived or whatever the case may be, it's several months later. And I find that first 3 months is quite critical, right? Like mom needs a lot of sleep. They need support, maybe if they've decided to breastfeed. Like there's a lot of things that the dads can do. So that's when I spend a lot of time, even during the pregnancy, talking to the dads or the partner, if the woman has a partner or a sister or mom, whoever it is, to make sure that they can really support through the labor and delivery, but also postpartum. So we have to make sure breastfeeding is going well. If they've decided to breastfeed, we have to make sure that recovery is going well, because some women have, whether it's a C-section or what, there's so many things, as well. Vag births, like, so they need to make sure they're recovering. So some things we can do from a nutritional perspective and herbal perspective to make sure the breast milk is sufficient if she's having low breast milk. And then I always work with either someone like yourself or a lactation consultant to help with that. And then also we want to make sure her nutrient levels are good, because the baby takes a lot of nutrients, right, from the mom. So we need to make sure that that's really, especially for help with recovery. So we want to make sure she's getting the right nutrients, the right vitamins, and then of course all the emotional support. So there's many different pieces to the postpartum. I would say emotional, physical, and then also biological, like she's losing calcium, for example. We want to make sure she's getting calcium, that kind of thing. And then sleep. And then the other thing that most people don't realize, or they don't know how to put a word to, but that's, I would say, stress. So like the adrenal glands release stress hormones. So we don't realize that the stress could be happy. We could be happy that we have this baby, but we're also really stressed, right? About taking care of the baby or not sleeping well. And that's a stress on the body too, right? So really managing that stress response is really important too.
Yeah, I'd say that the fourth trimester is like the most underrated part of the journey. Like it catches a lot of people by surprise. So I definitely want to encourage everybody to get support and get support early before the baby even comes. If you can do things like breastfeeding classes and things like that in your second and third trimester, that's really when you want to do it and get the hang of it. And I know that might seem kind of counterintuitive because the baby isn't here yet, and it looks easy on YouTube and on TV, but I can tell you from my own personal experience, I was not successful breastfeeding because I didn't have the support that I needed, and I waited until the fourth trimester to try to figure it out. And eventually I got overwhelmed, and I was just like, I'm just going to give my baby formula, because to me, a fed baby is best, and I can't figure out this whole breastfeeding thing. So
I agree. Yeah.
It's because of preparing way beforehand. So yeah.
Yeah, absolutely. And then also getting the support during that postpartum period. So I'll always give the partner or the dad or whoever my contact information. I'll be like, you be the one to call me, because she's going to be overwhelmed, right? Like it's because you need that support. And I had trouble breastfeeding, and I remember it was a lot of work, and I know this stuff. Like I was doing this well before I had my kids. I know all this stuff, and I still struggled, even though I had the information. It's because you're tired, and your baby might be too little. Like if he or she's premature, like there's so many different factors. And luckily I had the network and the support, but that's why a lot of women struggle, because like yourself, they don't have that knowledge, right?
Yeah, and Taylor is saying build your system before you're overwhelmed. Absolutely.
Yes,
that is the key.
I agree.
Yeah. Okay, so we will go ahead and move forward. I wanted to ask you, like, what myths can you dispel about fertility, pregnancy, or the postpartum period?
Oh, so many. Okay, so for fertility, I would say one of the big myths is that it's all about the woman. Like, yes, the woman has to house the baby, the woman has to birth the baby, the woman has to carry the baby. But as I said before, getting pregnant is all about the sperm too. And so that's something that I feel like, I know it's hard sometimes to really look into that, but I feel like it's a really critical part, especially if you're having trouble getting pregnant or have miscarriages or things like that. Really make sure that you're looking at both partners. Another myth is that you have no control. You can't do anything. For sure, there are some things that are not in your control, but there are things you can do to sort of make the process more smooth, right? Same as labor and delivery. You have to get this baby out. So, you got to do it, but there's ways you can do it in a more smooth way, or ways you can get support, or ways you can get, a holding hand. There's ways to do it that are a little bit more supportive. So that's another myth. There's actually quite a few myths. I'm trying to think of like postpartum too, there's all these myths, like you said breastfeeding's easy. Like that's not true. I would say the majority of women, it's not easy. And so I feel like that's something that you can get support with. And this is why I feel so passionately about it, because I feel like there's so much that we don't know, that we think there's nothing to know. We think, we just have to, it's just natural. It's just, I should just be biologically programmed to do this. No, that's not how it works.
Yeah. And I do want to dispel the myth that like breast is best. I personally think fed is best. So if you don't want to breastfeed, if you don't like breastfeeding, if it's something that's really just uncomfortable for you, you do have permission to feed your baby in whatever method or form is best for you and your family. There is no right answer or breast is best. I don't want people to feel guilty about that, because I think a lot of times feeling guilty about that too. Like, I can't feed my baby from my body, so like I'm a worse mom. Like, and I don't want people to feel like that either. So I just want to say that.
And I would agree with you. Even in healthcare, I mean, obviously we try to help women and support them in however way we can. But I have told women when they're having mental health issues or they're like at the end of the rope, I'm like, maybe you should just give this up. Like, it's okay. Your baby's healthy. Like, why do you need to put yourself through this? So I think every situation really, you just do your best. Your baby's fed. You're fine. Your baby's going to be just fine.
And they come out perfect. My daughter's 2.5 and she's perfect.
Exactly.
Yeah. So I wanted to ask you too around like language that people are using when someone in their life is going through a fertility journey. Like even coming up with the questions to ask you today, like I wasn't sure if I should say fertility or infertility, or like what sort of language people should use around it. I know it can be something that is sensitive. It could be something that is personal. And so for us who know in our lives that someone may be going through this challenge or this journey, like what are some things that maybe we should stay away from saying, and like what are some things that are okay to say, because you want the person to know that you're there to support them, but you also don't want to offend. So
that's a great question. It's a great question. I've been to family gatherings, and sometimes I have to tell like an aunt of mine, I'm like, stop asking her when she's going to have kids. Like, stop asking, it's personal. And I think people are well-meaning. I don't think they mean to be, insensitive, but it can come across that way. So I think that's a great thing that you're saying. People do use infertility a lot. I don't like that word personally. I feel like it implies that something's wrong with you. And I don't like that. I feel like, if something is going on in your body, that doesn't mean it's your fault. It doesn't mean there's something wrong with you. Your hormones maybe need some support. Maybe, for whatever reason, you're struggling with fertility. That doesn't mean that it's your fault. It doesn't mean that something's wrong with you. Women get a lot of guilt around like their role as a woman. So I personally don't like that word, but I know that the infertility community tends to use it a lot. I personally work with fertility journey, that kind of thing. In terms of what to ask, I would say don't really ask people, when are you having a kid, or even when are you having another kid? Like sometimes it's a second kid, right? Or a third. So I would just say, is there anything you need? Or like ask in a way that I'm here for you. Or, I think a lot of people will say things like, oh, well, don't worry, you can just try again. Or, oh, well, you should go on vacation and relax and then it'll happen. Like these are things I think are very insensitive, because you don't know that person's journey. You don't know what they're going through. And to be honest, most of these people don't know anything about medicine or healthcare. So they don't really know what's going to happen or what is actually happening in that person's body. So I think more supportive messages are really helpful. So I'm here for you. Is there anything I can do to help you? If you ever want to talk, because maybe they don't want to talk about it, but if you ever do want to talk, you can call, like something like that. And some women find it very helpful to open up, and some women just don't want to talk about it at all.
Okay. Okay, I love those tips. So tell us a little bit about what it looks like to work with you and like anything else that you want people to know.
Yeah, so I mean, if you're working with any naturopathic doctor, I would say that everyone has a certain approach. In my case, I've moved towards a more educational approach over the years. I've been in practice for almost 18 years. And so now, because I'm doing social media, it's a passion of mine. I'm doing it because I want to educate women. And so a lot of women will reach out to me from all over the world. And so it's an education base, because I can't check your blood pressure if you're, in Europe or something like that. So for me, working with me, it's all about really understanding your body. So I explain, this is how your body works and this is what we're looking for. So if you've noticed ovulation on this day, this is the best time for you to, try to get pregnant. And so a lot of it is really helping to understand what's happening in your body. So you have the language, the knowledge, and the understanding of your body. And then some of that is also educating people on what questions to ask to their health providers. So say they're going in for blood tests. A lot of women don't realize when you first go into your doctor and you say, oh, I'm going to try to get pregnant, they do all these blood tests for you. And they think, oh, well, everything was normal. Well, the first test that they do when you don't have a fertility problem, you're just like, I'm just going to start trying now. They're testing you for STDs and, like public health things. They're not checking your fertility. They're checking your general health status. They want to make sure that you're okay, right? And then you've been trying for a year and you're like, oh, well, my doctor already checked me. Well, your doctor checked you for your general health, but they didn't test your hormones and your ovulation, that kind of thing. So a lot of what I do is educate, like, this is what your lab tests mean, and this is what you now need to investigate. Or, hey, you have this symptom that could indicate a thyroid problem, and thyroid is impacting your fertility, right? So it's kind of putting together, I would say, more like investigation or putting together puzzle pieces and then giving people the tools, the knowledge, the direction, like, oh, this vitamin might not be good for you because of XYZ, right? Like, or you seem to have anemia, you need to look for something that has iron, like that kind of thing. So a lot of it is just putting together the pieces and giving people almost like what I would call a roadmap towards how to progress, how to work with whoever health provider you have, or how to try naturally if that's the way that you're going.
Okay. And then how can people find you and work with you, right? Because you work with people virtually. I know you're in Canada. But
I do. Yeah. Yeah, absolutely. Yeah. You can just reach me through, I'm on Instagram. It's just my name, Rishma Walji. I also have a website, rishmawalji.com. Everything's under my name. So you can just reach out. I have a lot of free resources too, if anyone's looking for like that handout on how to track your cycle properly. But I also have information on fertility issues and, lots of different, I also have one on, someone was asking, I think on your Instagram, how to get pregnant when you're over 35. And so I actually did a lecture at a fertility conference earlier this year before all of the shutdowns and things like that. And so I recorded it, and that's a link on my Instagram too. And it's free. People can just go and watch the video and see the whole lecture on how to get pregnant when you're over 35.
Okay, awesome. And so everybody go follow Dr. Rishma Walji. She's absolutely incredible. As you can see, she's a wealth of knowledge and she's a great resource, and you can work with her virtually anywhere all over the world. So she can definitely help you over 35. Doesn't matter what the situation is. She's definitely the person that you want to talk to. And then if you guys have any other questions, feel free to DM me. I will make sure to pass them along. And then if need be, we can do this again and answer people's questions. I didn't see too many questions come through the comments, but if you guys have questions that come up later, feel free to go ahead and message us. We will definitely get you the right information, evidence-based information that you can actually use to get to the goal that you have. And my fiance
Thank you so much.
Great info. Thank you, Matthew.
Oh, good. Congratulations.
Thank you. Not that we're trying, just to be clear.
No, but you're engaged. That's exciting.
Yeah. Oh, thank you. I appreciate that. Yeah. Okay. Well, I feel like this was like such a great live. I don't want it to go too long because, like I said, we could talk about this all day, but I definitely appreciate you being here and I appreciate your knowledge and expertise. Thank you so much for taking the time to do this.
Thank you so much. It's such a pleasure to talk to you. And I love all the work that you're doing. I'm going to definitely send people your way as well.
Thank you, and same. I love all the work that you're doing as well, and I will definitely refer you to, because it's so exciting just to be able to hear like all the things that you can really do to help yourself, like get pregnant and then have a healthy pregnancy. So I'm excited about that as well. So thank you so much.
Yeah. Bye, everyone. Thanks for joining.
Thanks so much for joining.
Bye.
Bye.